all, Tom Moran here from Tom's Big Spiders. This episode will be the second part of my podcast interview with Dr. Andy Anderson DVM. We talk a bit about tarantulas and veterinary medicine as it applies to tarantulas. This was an awesome discussion and a very long discussion, hence why I broke it up into two parts. So for folks that watch part one and we're waiting for part two, here it is. Now, this episode, we're going to be talking a bit about injuries that Dr. Andy Anderson has treated, the Tarantula ICU, and he's going to talk a bit about just the state of veterinary medicine as it applies to inverts in the United States. Now, just a heads up, this is from a podcast. A podcast is basically a lot of talking. So I want to give everybody that heads up. This is not a regular video. Every time I put one of these podcast ones up, somebody comes up and says too much talking, which is kind of like going to, a music concert and saying too much music. That's what it's about, guys. So if you're not into that, totally cool. Feel free to tune out on this one. But for those of you that want to hear somebody chat about tarantula medicine, especially from an expert like Dr. Andy Anderson, this one's for you. So enough of just me on video talking. Now we're going to go to the actual part two of the interview with Dr. Andy Anderson. Good morning, good afternoon, or good evening. Tom Moran here from Tom's Big Spiders. So for this episode, it will be part two of my interview with Dr. Andy Anderson, DVM, Doctor of Veterinary Medicine, who was fantastic enough to come on to the podcast and answer some basic questions about tarantula care, tarantula health, and veterinary care. So last episode, we talked about, in case folks didn't listen to last episode first and listen to it out of order, we talked about DKS symptoms, causes, and treatment, dehydration, impaction, molt issue, and nematodes. Now, for this episode, and this is why I wanted to break it off here, first, he will discuss some of the injuries he's treated, and I found it very, very interesting because as we were talking about it, I realized two of the causes of the injuries are things that I have addressed in the past through my husbandry and whatnot. So it was nice to hear confirmation that some of these issues, some of these ways we set our spiders up can actually put them in danger. And some of the things we choose to do with our spiders can put them in danger. We will then talk a bit about the Tarantula ICU. Why does it work sometimes? Why wouldn't it work others? Again, I've had some instances recently where I've actually busted out I hate to use the term, the Tarantula ICU. I took my spider out and put it on some paper towels in a smaller plastic enclosure. Let's put it that way. I hate calling it the Tarantula ICU, but that technically is what it is. So we talk a bit about that. Also, if folks remember, back in November of 2020, I did a podcast called Some Thoughts on Tarantula Euthanasia Methods after watching a YouTuber basically drown his in Dawn soap and water, which was horrific. And Andy was nice enough to email after and share some of his thoughts on that. So we're going to discuss that a bit. And then we're going to talk about the current state of veterinary medicine and the hobby's reluctance to pursue veterinary care for tarantulas. I think a lot of us out there are of the mind that they don't know how to treat them, so why even bother? And then how do you locate a good vet for your tarantulas? So again, really excited about the second half of this, and one of the reasons I broke it in half, I know some folks were like, oh, 2-hour plus podcast would have been amazing. It's because of the fact that people tend to drift off at the end, and there's some really important information here that I really want people to hear. So as I say in the videos, once again, enough of just me talking. Let's have me and Andy talk about veterinary medicine and learn some more about tarantula health and care. Now, the last one we have as far as medical topics, just overall injuries. What have you seen as far as tarantula injuries? And what are some, I can't think of too much besides molt issues. I've been privy to several cases of tarantulas falling, rupturing an abdomen, falling, hurting a leg. I've seen a couple situations where they've gotten legs caught and pulled off. But have you seen anything in terms of injuries? Abscesses is something that comes up sometimes.
Yeah, I've never seen an abscess. There is a case study of I think it was a T. sturmey that somebody fed a live mouse to, and the mouse bit it, and it got like an abscess or a granuloma on the abdomen. But otherwise, I have not seen that. Kind of going back to our talk about obesity, I do think potentially if you have some molting issues and you have an obese tarantula, maybe there's some weakened areas in the exoskeleton, and maybe tissue can poke through, and we're seeing what we think is an abscess, but actually it's like a hernia of some kind.
Yep.
Again, no proof, but
it makes a lot of sense.
But no, so I've never seen that. I have seen lots of injuries, getting legs caught in things. I have had a tarantula get stuck in the mesh
Thank you for bringing that up.
of an aquarium. Yep.
Yep.
And basically it like spun around itself and kind of strangulated its legs. And so they were still sort of attached, but couldn't detach them. And so it was bleeding. I've had lots and lots of falls. Most tarantula injuries are related to handling.
Yep.
Just, I know people don't like to hear that, but it is what
I know.
it is.
Yep.
They jump or they bolt or they get a puff of air or, who knows?
Yeah.
And they, will make a break for it and they fall onto the floor and they just, pop like water balloons, unfortunately. Again, obesity, if you fall and you are very, very heavy,
you're going to pop.
You're going to pop. So, even a very svelte tarantula is going to have an issue if it falls from a large height. But I do think being overweight contributes. If they rupture their abdomen, there's not much we can do. If it's a really small tear, you can put like it's basic super glue, that cyanoacrylate glue on there. And maybe it'll be okay. The liquid glues work a lot better than the gel, like the no drip.
That's good to know. I was literally just thinking in my head, if I ever did that, I'd have to use the gel. And as I'm thinking that, that's good to know.
Yeah, so it's hard because, the gel is nice because it stays in place and you're not going to just like glue the tarantula to itself. But it doesn't adhere as well.
Gotcha.
So there's that. Legs, the nice thing about tarantulas is they have evolved to lose their own legs if they have an issue. So that's called autotomy, and they will shed a leg and seal off the wound, and often you don't have to apply anything to the stump. There are some. I have actually talked to some other veterinarians who have seen tarantulas and thought they were doing a good thing, and they were anesthetizing them to remove legs, which is fantastic that they don't want them to be in pain.
Yeah.
I think it's great. However, tarantulas, because of the way they evolved, they can only lose their legs if they're conscious. It's a conscious response on their part. So
now you're ripping.
They have to be awake. Yeah, so they have to be awake, and you can just grab their leg at the femur, like a pair of forceps or something. And if you just tug upwards kind of quickly, they'll shed that leg, and then they'll seal off the wound. So usually, if there's like a leg injury, that's what I advocate people to do. It's just too much, they're too hard to glue or put the cornstarch on. And the exoskeleton in the legs is a lot stiffer than it is on the abdomen, so it's harder to get it to close. So yeah, they can just lose a leg, but they do have to be conscious for that to work. Mm-hmm. And otherwise, I haven't seen or heard of too many injuries. Everything seems to be handling related, or something happens during a rehouse.
And I'm glad you brought up the handling part, because again, I get both sides of it. I really do. And I know there's people out there that are hardcore don't handle, and I've never done that, only because if you tell somebody not to do something, they're going to do it. And I try to serve as an example where I don't handle on general practice. But I've tried to convince others before that here's the situation. Like you may think that 99% of the time you handle that spider, there may be no issue whatsoever. But that one time there's an issue, it can lead to tragedy. And over the years, I have heard from many, many people who have had just heartbreaking stories. Like one with it was a T. albipilosis. It was their first spider. They got it when they were 14 years old. Fast forward 25 years later, they take it out to show some friends at a party. One of the friends reaches to touch it, runs up their arm, off their back, on the floor, dead. And it's
Ugh.
horrible. I'm not one of these, I've never had an I told you so personality, especially with something like that. But I do like to share the example so people recognize, yes, you may love the spider. There may be nothing that can go wrong with it, but that one time something goes wrong, that's all it takes. And sometimes people experience that and it's horrific.
Yeah, yeah. It's just, to me, the risk reward ratio
Yeah,
isn't
I agree.
skewed high enough in the reward. So I don't handle any of them.
Yeah.
I have a very nice female H. chilense that would
Mm,
probably be fine. I mean, she's
yep.
adorable. She comes out and like investigates when I open the enclosure and would probably be okay.
Yep.
But I would never hold her because God forbid something happened. That would be awful,
Awful. Yep.
So, I always tell people I have to advocate for the pet and what's best for them. And what's best for them is not handling. And if they choose to handle, they are doing so with the knowledge that something really bad could happen.
They're
And
assuming those risks.
and if you still decide you want to do it and it's worth it to you, I say go ahead, but be prepared for bad stuff.
Yeah. I'm also glad you brought up the wire mesh because again, I think what happens is like with the water dish thing, people will go, I have kept them in cages, enclosures with wire mesh for 20 years, never had an issue. And I believe them. I'm not calling, saying that they're making that up. But I've personally experienced myself several different times. Unfortunately, it took me a little bit to learn my lesson with it. And I've been privy to many other cases where people have had their spiders come home, found them dangling, and I think, and we've talked about, I did a whole podcast about risk versus reward and why some people choose to do something, even though they know there's a risk, and how, sometimes it's just the way the hobby goes. There's certain things you're going to have to kind of decide, is this risk worth it? Do I feel like it's enough of a risk? For me, because I've experienced before, it's not worth the risk. I always swap out any wire mesh on any of my enclosures. Now, even the arboreals, I've heard that the arboreals couldn't get caught. I had an arboreal get caught. I watched it happen. Fortunately, a dingus tried to get footage of it as I was trying to help her out, and I never hit the record button on my phone because I want to be like, look, here it is. But I'm glad you brought up that this is an issue and that you've actually treated animals that have had their legs caught.
Yeah, again, pros and cons. What are
Mm-hmm.
the cons of swapping out the lid? You've
Yep.
spent money on a new lid. Either you buy a prefabricated one that they make now, which are
Yep.
great, or you cut the mesh out and put in some acrylic that you've drilled. One is cheaper than the other.
Yep.
So whatever you want to do. I am not a DIYer. I mean, everything I
Yeah.
make looks just awful, and I can't stand it. So I just
Buy them. Yeah.
I buy them because I just would not ever be happy with what I can make. Some of the newer products coming out now, they'll have that like punched metal
Yes.
where it's just the holes. And I actually bought one and uh, had my tarantula walk across it to see if anything would get
Oh,
caught.
yep.
Nothing, so far, nothing seemed to get caught. Everything seems spaced far enough apart. And it's just like, the texture of cork bark is full of like little pits and holes and things.
Yes.
So I
Yeah.
just assume the punched metal will be okay because there's not any like little wires to get stuck in.
Well, it's those
So that's an
crisscross wires.
option.
Yeah. And
Yeah,
I'm
they
glad you
just get the
mentioned that.
claws.
Yeah.
Hmm.
I'm glad you
Well,
mentioned the punch metal because I've been working with a lot of those lately. Didn't even think of having the spider walk across it. So that's fantastic. And that's been the one thing I've been kind of waiting for. Like I've been using them on a couple cages and I've been picking up those barbarous growth enclosures or reptile growth enclosures, which the name cracks me up, but I love the enclosures. And they have these
hmm
big vented hatches in the top that are made out of that punched aluminum or whatever it is. And it looks good. I have seen when I put one of the spiders in it. Again, I did catch her kind of climbing across the top and I'm like, oh boy. And there was nothing. So I do think with the wire, people ask, well, what's the difference with the wire? It's two different layers. It's a wire laid over, and for lack of a better term, soldered onto another piece of wire. And there's so many little nooks and crannies in there that I think that's sometimes how it happens. They're so close together, they get their toe claws caught.
hmm They can also get caught in like carpet
Carpet.
and things like that. So it's just their
Glad you
little
mentioned that.
hooked toe claws get stuck in everything. And could they get stuck in the punched metal? Potentially.
Potentially. Yep.
But I think it's less of a risk. So if people want to go that route, they can do that. Otherwise, yeah, I try to swap out my tops. I do, I do have two enclosures that I just got that do have the wire mesh in them still. So I'm not immune from that either, but I am planning on switching them out like I have the others.
It's funny you mentioned that. I got caught in an older video where I was panning over something, and somebody, eagle-eyed people that watch your videos will scour them for anything in the background. They're like, what's with that enclosure there? It has a wire mesh, and it was one that I got in a spot. I put the spider in. I hadn't had a chance to replace the top yet. I'm like, good eye. You're absolutely right. But I did go ahead and replace it. So I think we've all been there. It is. And I do want to point out, because there's people that are going to listen to this and freak out and go, but how common is it? Probably not very common, considering how many of those enclosures have been out there for years and people have used them. I just think it comes down to when it's one thing to go, this could happen. When you actually see it happen, that's what kind of makes you get a little gun shy and go, all right, no, I'm not doing this anymore. I had it happen with mine. Caught her hanging, came home from work. I don't know how long she was hanging there. And that was an eye opener, because I won't say I scoffed at it, but I kind of thought, how realistic is that? When you see it happen, it's suddenly, all right, now the risk isn't worth it. Now I see it can happen. I don't want to see that again.
Yeah. Again, no, you're right. It's not super common, but why take the risk if you could prevent it completely? It just seems better to err on the side of caution than not.
I agree. So the next topic we wanted to bring up, and we had talked about this beforehand, the infamous Tarantula ICU. And
oh gosh.
Yep, I have a funny feeling where this is going to end up. I, for years, have talked about the fact that I scoff at them quite a bit. I think it's like, and we talked about this before we went on the air. You have a spider, it's sick, so I'm going to pull it out of its natural habitat. I'm going to drop it on some moist paper towels. I'm going to stick it in a plastic container, put it on a shelf, and woo, it's going to be healed. And then I also mentioned that I had a couple situations lately, which I'm starting, even just through our discussion, realizing what probably happened, but where I had spiders that looked like they were completely like ready to go. One of them I was pretty sure was dead. Took it out, went, well, might as well use the Tarantula ICU, which I hate calling it that. I just told everybody I put it in a plastic container with some paper towels, but arose by any other name. It was the Tarantula ICU, and I had two of them come back from it. So what are your thoughts on the Tarantula ICU? Why might they be working sometimes, not others? What do you think about them?
I think so. In medicine, it's hard to say why something has worked, or like what something is sick with, or anything, without testing. So I think part of it is, we have a lot of spiders that people are putting in the ICUs, and we have no clue what it is that they're sick with or why they are acting the way that they are. Yep. So I think in the case of dehydration, which is super common, I think a lot of them are putting them in the ICU, and they have access to a water dish, and they're drinking water and they're rehydrating themselves. And we go, look, the ICU fixed this.
Yep.
And I guess in a way it did. If that's the only place they have access to a water dish, then yeah, it did help. I think, well, let me backtrack. So tarantulas, have a cuticle covering their body, and their cuticle is in 3 different layers, and the epicuticle, or the outermost layer, has like a wax that prevents water loss. Yep. It also works, the other way. It doesn't let water in. If you've ever dropped water on your tarantula, it kind of beads up and falls off. Showing, that it just doesn't absorb. So I think the thought that we're putting them in these humid environments, and they are absorbing fluids to rehydrate themselves, that's just not correct. Yep. I think I think in an email I told you it would be like, if you were really dehydrated, because you were out working in the yard all day in 100-degree weather and you would, sweat all day and hadn't had water, you wouldn't go stand in your humid shower
Yep. I
and
remember that. Yep.
rehydrate yourself. And our skin is much more permeable than tarantula exoskeleton, and we cannot rehydrate that way. We are, someone I'm sure is going to say like, oh, well, we're much larger, so we would need more time or something. But
Yeah.
it just doesn't work that way. So why some of them get better, I think, is because they have water to drink and they rehydrate. I think another thing is we don't know what they were sick with. Potentially, we could have put them anywhere and they would have gotten better, because they were just going to get better. It. Unfortunately, part of medicine is that we don't know everything, and I have had cases where I was like, oh, this is so bad. This animal is probably not going to be here for much longer, because they're so sick. And occasionally I've had people take them home and they call me and they're like, you're a terrible vet because Fifi
Oh,
is still alive. And I'm like, well, that's wonderful. Like,
that's
what a
great.
great thing to be wrong about.
Yeah.
But who knows why Fifi got better?
Yeah.
Sometimes we just haven't found what they were sick with. So I think that happens a lot. I also wonder, I've again no proof, but I wonder if some species that are from more humid environments, I am sure that their book lungs, work better in a humid
Good
environment.
environment. Yep.
Maybe being in a more humid environment, they're able to breathe better, they're able to oxygenate better. I don't know. I think instead of taking a tarantula out of its enclosure, you know, in the hopes of rehydrating it with extra humidity, maybe take it out and just give it access to a water dish.
Yep.
And maybe go about it that way. I do think sometimes people have them in such large enclosures that if they do offer water, the tarantula can't find it or it's not full enough. So maybe putting them in a smaller enclosure where they're like, the water's right here.
Yep.
Maybe they are able to drink then, and rehydrate themselves. I do think a lot of people are not giving them water, as we discussed. And so why the water is not important until they're sick, I don't know, because
Yep.
they'll give them a water dish in the ICU. So I think a majority of them are just dehydrated and they're drinking water. If there's no dish in the ICU, maybe they are able to drink some water from the sides of the enclosure or something.
Paper towels. I've seen them hanker down, kind of absorb it or suck it out of the paper towel.
Sure. They're chewing up paper towel, like, they'll chew their exoskeletons to get some of the fluid out. So, I don't think necessarily the ICU is a terrible thing.
Mm-hmm.
I just kind of scoff at the idea that they are magically rehydrating from being on a moist paper towel.
Yeah. And I think that's where I've been on it. And I think the times that I think it had worked, I wonder if the spider was just dehydrated and that just gave it. I mean, again, I've always got the last case I had, that was what confounded me so much. It was, what species? Well, I had it happen with one of my Psalmopoeus species, and I put it in there and it magically came back. Now it had a water dish. I thought it had access to water, but it definitely appeared to be a sluggish, lethargic spider that was having a hard time controlling its limbs. Kind of points to dehydration. So whether it didn't find it, I've seen situations where they molt and they're dehydrated after the molt and they don't get to moisture and you start to see them act sluggish. So again, I think that points to the issue where a lot of folks, when there's something wrong with their tarantulas, they have no idea what to do. And so this is like their last ditch effort. And like you said, I think sometimes it pops back because it might've been a dehydration issue and it got what it needed. Mm-hmm. Or like you said, you took it out of the environment. I have had worries before about some of my fossorial species being in a situation where they're in the same enclosure for a long time. I'm pouring water into the enclosure repeatedly. There's nowhere for that water to go. God only knows what type of bacteria starts to, fester down there. And that by taking it away from that environment, maybe that allowed the spider to kind of purge itself or whatever it had and get better. But it wasn't so much the ICU. It was the fact that I took it out of what was turning into kind of a toxic environment for it.
Right. And, they have found different species of bacteria infecting tarantulas. I think it was an H. gigas that they cultured a bacillus species
Ah,
causing an infection. So they do
I
get
can't get it.
infections. There are fungal infections that they could get. That I think that's now with The Last of Us big on HBO.
Yeah,
I
yeah.
feel like that's gonna be like our new thing. Is it fungus? But yes, so there are other things that it could be, and maybe removing them from the environment cuts down on the bacterial load that they have in their own immune systems. They're able to kind of take
Gotcha.
over and get them better. So, I'm not going to say don't do the Tarantula
No.
ICU. I'm just going to say, think a little more critically about
Yeah.
what it could be, because that's only going to help, you know, telling people that magic humidity is going to cure
Yeah.
all of these things. I think just kind of leads people down the wrong path.
In some cases, kind of the old Band-Aid on a heart attack. Like if your setup is completely wrong, which led to this, you take it
Right.
out, you give it what you need, and you don't fix that setup or revisit why did I get from here to here. That could be an
Right.
issue.
For sure.
So the next topic, and this is one I've been waiting to address with to talk to you about, because a while back I did some thoughts, the podcast, some thoughts on tarantula euthanasia methods. I think it was in 2020, end of 2020. It was because a rather popular exotics YouTuber was trying to do an episode about how to humanely dispatch your animal if you think it's too far gone, and decided on putting it into water with Dawn soap and basically drowning it. And it was kind of
Oh,
infuriating, and
that's
it was
awful.
upsetting. It was awful. It was just, I don't know. I don't want to get all worked up over it again, but it seemed very exploitive. It was like, look what we can do. And we hopped online, and he found that he was just pulling up random ways that people kill their animals. And that's what he settled on. But after I put the episode out there, you contacted me and you had some excellent thoughts on it. And I know some of it involves, pain. You obviously specialize in animal pain and preventing pain. What are your thoughts on this? I know we had talked about some of the methods, and you really made me rethink some of the things I was doing, and I did bring them up in the podcast afterwards, because I never want to put anything out there and then have not give the other side of it. What are your thoughts on tarantula euthanasia and some of the how to go about it if you come to that conclusion?
So I think part of this is there's a big debate. You seem to have two different camps of tarantula hobbyists. There are I'm going to make them cute polymer clay hats and pose with them, and
Yeah,
we're going to snuggle, and they come when they're called. And
yeah,
then you have people that are like, you know, they're barely alive. I like to look at them, but they don't have any kind of feelings or
yeah.
anything. And there doesn't seem to be like a lot of
A middle
people in the
ground.
middle.
Yeah,
I'm going to upset people, I think, but I do not believe, and there's no science proving that tarantulas enjoy snuggling and wearing little witches' hats. Is that hurting them? No. Again, I don't think handling is great for them, and it's probably stressing them out. Is that really affecting them? I don't know. But I do think we don't have proof that they feel pain.
mm-hmm.
Um, it's really hard to prove that. The pain in a medical context is a sensory and emotional experience associated with real or potential damage.
Yep.
Do tarantulas have emotions? I don't know. It depends on what your definition of emotion is, because there's not one single definition of that either. Um, Usually, if we're talking about an animal that we're not sure, do they feel pain? You can call it nociception. So they feel, noxious stimuli, or they feel potentially damaging things. But maybe there's no emotional component to it. It's purely, a reaction to prevent, major damage to their
Yep.
body.
Yep.
So I think I'm a little more sensitive to it because I am certified in pain
Yep.
management. So like that's
Yep.
always at the forefront of every animal that I see is this animal in pain? Could it be in pain? What can we do to prevent it or treat it? Um, a lot of drowning to death in Dawn dish detergent and water is, I don't know how anybody could defend that. That's just cruel.
Yep.
It is not a pleasant way to, drowning is not pleasant. The tarantula was conscious. So I think that's wrong.
Okay.
Freezing, putting in the freezer or putting in the fridge, I know is pretty popular. There have been some studies showing that the ice crystals forming, that animals are conscious, invertebrates are conscious as those ice crystals are forming in their bodies, and that's painful. Um, you know, as tissue freezes, everything is rupturing.
Yep.
Is that painful? Probably. Some people will say, well, they're so cold, it's slowing down the action potentials from the nerves and they're not able to ever reach their brain, or,
Yeah. Yeah.
I don't know. My thing is, again, I just assume all of my patients can feel pain
Mm-hmm.
or stress, and I do my best to mitigate that or prevent it if possible. And I guess I don't understand why not? Why wouldn't you? Again, what are the cons in assuming that a tarantula can feel pain or
Mm-hmm.
discomfort and just behaving as if it does? If it doesn't, if it cannot, they definitely can feel, noxious stimuli. Is that pain? Do they have an emotional component? We don't know.
We don't know.
But even if they can't, what's the harm in addressing it as if they can? I just don't see the argument for not. So I don't advocate for freezing them, putting them in the fridge. I don't like. I would never, of course, say put them in dish detergent so that they
Yeah.
drown. I mean, that's awful. In the hospital, we will use anesthetic gas. And we anesthetize them until they're not conscious anymore. Which with tarantulas, we determine that with their righting reflex. So we'll flip them over, and if they don't come, if they don't move to try to right themselves, and there's no leg movement, we just assume that they're probably unconscious. And I will either inject them with euthanasia solution at that point. And so they just don't wake up, they're not ever
Yep.
conscious, they just pass away, or leave them breathing in that anesthetic solution, and they can pass that way. At home for people, this is going to be rough
I know where this is
sounding,
going, I think.
but if you are not going to take your tarantula, you can call a vet and say, would you
That's
euthanize
what I
my
was just going to
tarantula?
ask. How would you know who, like, I know you know
Yeah,
how to do this. Would other vets know how to do
they
this?
should.
Okay.
They should. Will they want to do it? I don't know. That depends on the vet's comfort level. So if nobody will do it for you. I do think smashing them.
I'm
If you can
cringing
get,
as you're saying this because I
I
knew where it was going.
know, and I hope
No,
nobody takes this out of context.
no,
I'm
they
not,
won't. I don't think they will because I've been around. I grew up on a farm, been around animals my whole life, and the whole thing was always you never let anything suffer. Even back in
yeah,
the farm days, that was the big rule. You never let something suffer. And if there's even a chance, and I hate to say it, I've done the freezing method before with the thought process that was the most humane way to do it. And after we had our initial conversation about this, I've completely changed. When people ask me, like, this is what I did, but here's the thought process behind it. If they're feeling pain, this is a torturous way to go. And then I've encouraged people, when I encouraged, but told them that it sounds like the most humane way, if you're not going to seek veterinary care, would be the smashing method.
yeah. It's gross. It's
Yep.
very visceral.
Yep.
It's you don't get to save the tarantula afterwards and put it in a
Yep.
shadow box, which I
Yep.
know some people do. But I think if that's your option, if your option is, I really believe my tarantula is suffering, it's dying, and I can't get it to a vet, then destroying its nervous tissue in one go, I
Yep.
think is kind of our best bet. So I would do that. You have to do it very quickly and like really commit to it and get it done. And
I
it's
mean,
sad.
ideally, it should be
It's
between two very
awful.
flat surfaces with a
Yes,
lot of like instantaneous, the
for
entire
sure.
animal, not just
Yes.
like I've heard somebody told me, I don't even want to share this, but somebody used a hammer to do it. And
I probably would not. Yeah,
no,
because what if
I
you,
said, yeah,
yeah,
well, it didn't go well. I'm not going to share
yeah,
details, but it was a horrific email. And I was like, like, well, I'd heard smashing, but smashing, it's got to be the entire animal obliterated to, something somebody had done cinder blocks, I guess, would lay the animal out in a cinder block and then another one on top of it, instantaneous, done.
yeah. And again, this is if you cannot get into a vet and
Yeah.
if you are
Yeah.
absolutely sure that there's no other option. And it would all, I would only advocate this for, like a tarantula. Of course, we're not doing
Yeah. Yeah.
this to
Oh God, no.
other
Yeah, thank you for
other
that.
animals. And it's like it's a last resort kind of thing to prevent
Yeah.
suffering. Are people gonna like it? No, it's not nice. It's not a pleasant thing. But I do think we have to do what's best for the pet. And instantaneous death, I think, is a lot more pleasant than slowly
So yeah.
dying of something else. So, it's not a fun thing. Nobody likes to think about it, but I do think it probably is the best. But even a vet that doesn't regularly see tarantulas, they should be able to at least anesthetize it. If they don't feel comfortable injecting it with like a euthanasia solution, they could just anesthetize it with the anesthetic gas,
Yeah.
and just leave it in there until it is, completely passed. And I think I think that'd be fine.
Yeah.
They don't have to touch it. They don't really have to do anything. Most vet clinics have, um, containers that they can put, the anesthetic gas, pump the gas into, so nobody has to really, be involved.
Yeah.
But
Yeah.
yes, I think those are really the two ways that I would think are okay.
And I will tell you, after our last talk, I did have one of my older specimens, an old female OBT that absolutely adored, but it was obvious she was on her way out. And the game plan was that if she didn't get better, was to do the smash technique, not freeze. And as it was, she passed luckily rather quickly, so I didn't have to do it. But that did cause a change in my thinking, because traditionally it would have been, the cool them down in the refrigerator, then put them into the freezer. But like you said, even the thought of the fact that, all right, we assume they don't feel pain the same way we do. We assume they're not emotional creatures. But we don't know how that translates. They do get that response. They do know when something's hurting. They try to get away from it or attack, which leads you to believe there is some type of cognition of some type of pain recognition. I would hate to think that I'm putting it, as I'm trying to humanely, euthanize my spider, that I'm putting it through pain in its final moments.
Right. Yeah. Always err on the side of do what's best for the animal, regardless of the species. And I think, you're not often going to go wrong if you think about it that way.
Yeah. Well, I'm glad we covered that one, because I do get sadly, well, it's not sadly, it's part of the hobby. It's part of it, keeping any animal. There's going to be that moment where you realize, all right, this is probably it. And I know a lot of folks out there want to do what's absolutely right for their spider. And I agree wholeheartedly that at the end of the day, the most surefire way, obviously vet first, and then the crushing method, unfortunately, is distasteful as it sounds, is probably the way to go.
Yeah.
So as we're kind of winding down here, now's the point, and this has been a fantastic podcast, by the way. I'm trying to figure out, we're getting along. This might be a two-parter, only because I want people to really listen to the entire thing, because it's one of these situations with me where I'm learning stuff as we go through it. So I'm absolutely I'm playing host, but at the same time I'm playing listener, because I'm hearing this stuff. So it's been amazing. One of the things I want to talk a bit about, and hopefully you can fill in some of the blanks, is the current state of veterinary medicine when it comes to treating arachnids and tarantulas. And I have heard that because of the whole, pandemic definitely helped this, with so many people getting into these hobbies. Now they're probably dumping them all off, because that tends to be what people do. They get into something and All right, never mind. But it sounds like there's been more of a, this is a burgeoning area in veterinary medicine. Is there any truth to that? How does somebody become a vet that treats exotics?
Um, so I don't know if burgeoning would be the word I would use. I would say
I was
maybe
hoping.
there's a slow trickle. I mean, if you go from nothing to a few, I guess yes, it is burgeoning.
Darn.
Yeah, it's probably going to become more popular. I think probably in Europe it is more. There are probably
That's,
more
yeah.
veterinarians that are into it because inverts are kind of a bigger deal out there,
Yep.
and usually in that kind of thing, we are about a decade behind.
Gotcha.
So yes, there are more vets now that will see them than there were in the past. There are not many of us. But yes, there are some. In the United States, we do not, of course, have an invert board certification. Nobody is a
Okay.
specialist in invertebrate medicine. There are other board certifications. Exotic related ones are avian medicine, exotic companion mammal, so like rabbits, ferrets,
Oh, gotcha.
that kind of thing. There's a reptile and amphibian specialty, and I believe that's it, exotic wise. And then there's all
Oh,
kinds of you can be a board certified cattle, beef cattle veterinarian,
no
shelter
kidding.
medicine. I mean, anything you can think of, there is a specialty. There are, veterinary dermatologists, cardiologists, oncologists, surgeons. I mean, everything. Whatever is in the human medical realm, we have. To get one of those exotic certifications, you'll know somebody has it because then they'll usually have their name, DVM, and then it will say DABVP, diplomat of the American Board of Veterinary Practitioners, and then the name of whatever specialty they have.
Gotcha.
So you'd be like an avian diplomat or a reptile and amphibian diplomat. To get that, you either have to, straight out of school, do a couple more years of residency. So usually you'll go into just a regular like dog and cat residency, and
Yep.
then you'll go into the specialty for a couple years. You have to have so many hours of that particular specialty and do training, and then there's a huge test that you have to take. It is very, very difficult. And then if you pass, you get to say that you are boarded. And then I do not remember the time period in between. I think it's every 5 years you must retest. So they have to keep up with everything. Some vets will graduate and then decide later they want to be boarded, and you can do it that way. You have to have a certain percentage of your practice load be in that specialty. So if you want to do birds, I believe it's 15% of your practice load must be birds
Oh,
for so many years, and then you take that same test.
yep.
Um, I am not certified. I wanted to, but I wanted to do reptile and amphibian, but it is so hard to get placed that a lot of people don't make it into their residency, and so unfortunately, I didn't do it. And while you are doing it, you're working, you know,
Yep.
80 hours a week or more, and you're only making, $20,000 a year, and you have to pay student debt. So
Yep.
it's hard to go back after you've been
And
out
establish, and yeah,
and established. So yes, just because somebody's not boarded does not mean they can't see
can't
those
do it.
things. So if you can find somebody who's boarded in something, that's great. I will say, because they are boarded and they are specialists, generally the fees associated with them are a little bit higher because it is a
Yes.
specialty. But you get what you pay for. So they generally do, excellent jobs. Um, if you don't have anybody boarded around, you just call and say, I have a tarantula. Could they see it? And they'll say yes or no. And then, go in and make an appointment and go in and see them. It's tough because there aren't very many people who are going to see them. And a lot of exotics, before we had a lot of people being certified, it was just like old Doc Brown down the street who was like, sure, I'll see your turtle, because there was nowhere else, there was
That's what
nowhere
I
else
wanted to
to
bring.
go.
Yep.
Unfortunately, just like any career or profession, there are people who aren't quite as up to date as they should be on things, and maybe don't know as much. It stinks, but that's just kind of the way it is.
Yeah.
That is less common now that we know that there are specialists and that there's training for things. But it used to be that just anybody would be like, yeah, I'll see the turtle. We'll give it a go.
Yep.
We shouldn't be doing that anymore, because now we know a lot more and there are a lot more options. So, you can ask, how many of this species do you see a year? Something like that,
Yep.
to get a good idea.
Have you ever seen a tarantula before?
Yeah, I mean, really.
I mean, seriously, because
yeah.
And you bring this up, and obviously this is older experience, but like years ago, I was into snakes, and again, tried when anything would get sick, try to get veterinary care. And I did have one of those situations where we were like, it was actually poor Billy that was trying to find somebody, and she's like, I found somebody. They said, yeah, sure, they'll take a look at it. And it was readily apparent that when we brought the snake in, this person, he looked like he was terrified of the snake, and I had to hold the snake the whole time. And then was just like, yeah, I'm not sure what to do about it. It could be this, could be that. And then just sent me off my way with a bill. And it wasn't until we happened to find another one that had moved in from out of state. Apparently he had worked for or with a zoo before and had worked with exotics. And he was good. Like he's like, I'm not certified, but I've worked with a lot of snake, named off all the stuff that he worked with. And we used this guy for a good many years. He was fantastic. So I kind of got to see both sides of yeah, sure, bring it in. We'll give it a shot. It's an animal. And you'll get the ones that like, I've heard stories of people that are like, well, I'm a veterinarian. I can treat anything. And then they bring it in and they're like, it's painfully obvious they're not sure what to do. So I think that leads to that unfortunate issue where people are afraid to even attempt to bring their spiders to a veterinarian.
Right. And it's a shame. I mean, there are bad human doctors, there are bad mechanics. I mean, it stinks. It's not very common, but it just is frustrating when it happens to you, because then you're like, well, it's my pet. So I get it. I think also, when talking to other people about their vet care or their experiences, or, God forbid you go on Google or Yelp, it's terrifying. Sometimes people will say, they couldn't do anything, or they didn't know, or they gave me this bill and like they had no clue. And, yes, sometimes that's true. As somebody who sees exotics, often I will get, I'll get the records from another hospital, and the client will say, well, this doctor, they had no clue. They didn't know anything. And I'm very upset. And then you'll look in the record and it will say like, recommend radiographs, x-rays. Owner declines this. Recommended blood work. Owner declines this. Discussed dietary changes. Owner does not wish to make changes. So I would just take everything with a grain of salt, because sometimes, we have to run tests to figure things out. And a lot of times people don't want to pay for those. And so the vet will be like, I'm sorry, without tests, I don't know what is going on.
Yeah.
And so they'll say, well, they didn't know. And unfortunately, because exotics are so specialized, a lot of their testing, it is more expensive. It requires special equipment. It requires special labs to send stuff to. Exotic appointments take more time usually than a dog or a cat, because a lot of it is going over husbandry and, other stuff that you don't have to go as much into depth with for dogs.
Yeah.
And so exotic visits do tend to cost more than regular ones. A lot of, I'd say a lot of the issues are people wanting to save money and maybe go to somebody who charges less. And the reason they are charging less is because they don't know as much. And so they don't understand what it takes. And so, yes, you've paid less, but really you're not getting a higher quality of care. So, yes, people can definitely have bad experiences, but a lot of it, at least that I'm seeing, are that they just didn't want to do the things that were recommended. And so then, we don't have an answer for you. It's very, very uncommon that I can just look at a patient and be like, oh, it's this, and treat it. Sometimes yes, but often we do need x-rays or blood work or something. Otherwise we're just making educated guesses.
And I think there was one thing that you brought up in there that I think a lot of folks probably wrestle with is this hobby is one of the ones where it can be as expensive or inexpensive as you want it to be. And I think what happens is people kind of spend all of their money on buying the pretty spiders that they want to get. And we can go out, I can go to Walmart right now and come home with under $100 with enough enclosures for everything I've got. And then when it comes time to actually get them seen and get them taken care of, they're reluctant to spend that extra money. I've received that before. I was like, hey, you can definitely try checking with your local vet. Well, I'm going to pay $300 for a spider that I spent $50 for. And I think that goes back to earlier when we were talking about there almost seems to be two camps. There's the ones, like you said, they put on the fluffy hats, they decorate them, they, play with them, they talk to them, they think they come when they call. And then there's the other half that they appreciate the way they look, but they just see them sadly as like bugs, for lack of a better term. And they don't see them being worth that kind of money. And I think that's something kind of in the hobby that we have to wrestle with. We can't have it both ways. We can't say we absolutely adore these animals, and then when it comes down to it, go, you know what, I'm not going to spend a couple $100 to make sure that this animal that could be with me for another 2 decades is okay.
And that's part of why there aren't so many vets doing this, because there's no money in it, and there's no demand in it. So, why would somebody take the time to learn more if, one, they may never see one, and then you have people that are like, well, I'm not paying for it. And I think, people don't understand often that, like, they are not like, here's $50. I don't take that $50 and like put it in my pocket. I have to pay for the electricity, because I'm mobile, the gas to have gotten to the appointment, syringes cost money, blood work, the places that run blood work charge the vet money to run the blood. I mean, it's all these bills. Then you have to pay your staff. You have to pay for the medication. So there's all this kind of stuff. And then also people are paying for the experience and the training of the vet. And it's hard to convince people that that's worth it, because I can't show you my 10 years of experience and like, you can't hold it in your hand, And so you are paying to talk to the vet and for their experience. And if people can't take that home or like look at it, to them, we were just having a conversation. And it's hard to be like, well, actually, that's part of what you're paying for is the consultation. I could, you could probably go find syringes or something somewhere and maybe figure out how to draw blood, but are you going to be able to send it in? And if you do send it in, can you interpret those lab work results? So that's a lot of where those fees go, is just your vet's training and how to interpret and use all of those things together and give you a diagnosis or a treatment plan. So that's part of the cost. And I would say, if you spend $50 on a tarantula, you are going to spend more on vet care for that tarantula than it cost. So, you just are. So, it's kind of cold sounding and heartless, but, it's like, do you want this tarantula or do you want a tarantula?
That's a great way to put it.
If the answer is I want a tarantula, then don't seek medical care as long as the animal's not suffering.
Yeah.
That's fine. I will always, if something comes in and is just, I mean, suffering, regardless of how many finances, I will always humanely euthanize something for
Yep.
somebody. I'm not going to send something home suffering, but I can't just provide, free medical care because we
Yeah.
would go under, So yes, unfortunately, you're going to spend a couple $100 probably to take your tarantula to the vet. And that is a lot of money. So I understand the hesitancy in spending it. But again, you want this one or just a tarantula?
My tarantula.
You could definitely go replace it probably for less than that. I think there are some hobbyists, that spend a little bit more on their animals and maybe have some rarer stuff. And maybe maybe you do have a $400 tarantula. And so, would it be worth saving it if it gets really sick?
Yep.
That's kind of on a case by case basis.
And sadly, I don't think, and obviously you can attest to this, but Billy and I have had dogs for years. I talk to a lot of people. Oh, I love my dogs. It's not mutually exclusive to exotics. I found in just my own discussions with people, a lot of folks, even for their furry pets, are reluctant to bring them in. Like I
Yeah.
was talking to somebody like, oh, my dog's 10 years old. They can't see anymore. There's a big tumor on it. I'm like, oh, did you bring it to the vet? Nah, what are they going to do? Like, are you kidding me? Like, I've had dogs that have lived an extra 5 years after getting cancer because we bring them in. And we're obviously on that side where ours go in yearly. They get, when there's something wrong, we don't hesitate. Is it expensive? Heck yes, but it's part of responsibly, keeping a pet, especially one like a dog that's supposedly part of your family. So I think sadly, it's obviously worse because not many people are cuddling up with their tarantulas at the end of the night, but when you see it with a dog, when you see somebody that doesn't want to bring their dog in with something that is obviously could easily be handled by a veterinarian, you realize how big of an issue this is with exotics.
Yes, and it is. It's really hard to be a vet and see things that you could potentially fix, and people just don't want
Don't
to.
want to.
And so I always tell people, sometimes people will call and say, I'm thinking about getting a whatever. What should we do? And so we'll give them advice and everything. We'll also say, put money away for vet care.
Yep.
Don't get this animal until you have some money set aside, because if it gets sick, you're going to need a vet to take a look at them. And I think that's just it's not a fun part of pet ownership.
No.
You want to go buy new enclosures and new fun things, new
Yeah.
animals. Nobody wants to have this lump of money sitting there that you're just going to spend on a vet
Yeah.
visit. I get it, but we owe it to the animals that we have taken into our care to provide them medical care if they need it. And I often will get people that'll be like, oh, this is my child. I love them so much. I would do anything. And then you're like, it's going to be $300. And they're like, well, he had a
Come
good
on.
life. Yeah.
Oh, yeah.
It's what are your priorities? Where are your priorities? And if they're not with that pet, I don't think people should own them. But, if you happen to have a pet and your priorities are not providing medical care, that's very sad and disappointing. But I think the knee jerk reaction is, well, the vet should just do it. They should just do it for free because don't you love this animal? And I wish we could. But like I said, I've got bills to pay in a hospital to keep going. So as much as I would love to just do stuff for free all the time, we do have to charge something, to see these pets.
And just look at the state of human medicine. I mean, especially in the US, you're not getting anything for free.
No.
It doesn't work that way. With people, nobody expects that. Well, some maybe do, but in most situations, you're paying for it, regardless of what it is. So
Yes.
I don't see why it should be any different with animals. It's just, I mean, this can obviously be its own topic unto itself, and it's one that frustrates me. We've been with our vet now for, oh gosh, I think like 17 years or something. He's seen us through so many animals. Guy's fantastic, but unfortunately, when we come in, he knows we're like-minded folks, so we get to hear a lot of the horror stories of people bringing in animals and refusing to treat them and stuff, and it's just heartbreaking. And it's same thing. It's same types of stories where, oh, it's my baby. I've had it for the, yeah, how much? Never mind. You can keep it. You go ahead, put it down or whatever. Is that going to be cheaper? And it's sort of, and I get it. I mean, obviously with expensive stuff, it's awful. But with just day-to-day types of things and the grand scheme of things, if it's your dog or if it's your tarantula that you could have again for another 10, 15, 20 years, I think it's worth it. But
that's what, I think, with people with dogs get puppies, I always advocate vaccinating them because vaccinating them for parvo is much cheaper than treating parvo.
Parvo.
Providing a water dish for your tarantula and replacing the top is less expensive than potentially having to treat an injury later on. So, if money is an issue, why not do these things, to preempt having any like major expenses later on? It just makes sense.
So to button it up, where do you see veterinary medicine in terms of tarantula and inverts in the years ahead? Do you think, I know we kind of already covered this with the fact that the UK and Europe seems to be ahead of us by 10 years, but do you see this being something that starts to develop more, or are we kind of, this is what we're going to be kind of, what we're going to have in the foreseeable future?
It's kind of hard to say, I don't think it's ever going to become like this huge thing because, tarantula ownership is not going to become this huge thing. Depending on where culture goes, maybe we need like a really cute movie for kids with like a tarantula.
We
and
really
then
do.
Yeah, and then generally what happens is, both fortunately and unfortunately, those pets become really popular. Like everybody had a Dalmatian after 101
101 Dalmatians. Yep.
So, but I don't think the hobby is going to like explode and become super mainstream. So there's, we're not going to have an influx of tarantula veterinarians, and I don't think we're ever going to have a board specialty in invertebrate medicine. But I do think you're probably going to find more vets who will see them and provide care. But again, that is dependent on how many people are looking for it and asking for it, and willing to pay for it. If people aren't going to take them to the vet, then a lot of vets aren't going to take the time to learn about it because what's the point? We already have so much to learn. So I think
the onus is kind of on hobbyists to actually, if this is something we want, we have to start using it.
Yeah, ask for it, use it. If you have a vet who is interested in tarantulas but does not have a lot of experience, maybe bring them your tarantula and know that maybe you're not going to get like an answer, but maybe they could learn some things.
Yep.
If you want to go that route, and then they should be able to provide you care later on. Maybe they'll learn a lot more. It's just going to kind of depend on the owners and what they seek in terms of medical care.
Well, this was an absolutely fantastic discussion. I mean, I don't normally listen to my podcast back, but I feel like I have to listen to this one to take in more of the information. Again, it's been great because I've been sitting here kind of like reading the questions, but then just sitting back and listening and learning from it. So I truly appreciate you joining me today. Before we go, this is why I kind of wanted to check with you beforehand to make sure you did have a collection of tarantulas. Couple fun questions just to end it off. And I'm going to put you on the spot with this one. I'm going to apologize because if somebody did this to me, I would flounder. It's not going to be that bad, trust me. But first off, out of the ones you keep, what is your favorite spider, favorite tarantula?
Oh, gosh.
Yeah, sorry. I don't know why I'm doing this to you because I hate it when it's done to me, but it's kind of fun in a way. And then after we're done, you're going to think of a million different answers you could have said.
I really like my Imira. I don't know, the trap door behavior is just so cool and so different. And she's really very well behaved, very, very calm for a baboon. So I really like her. It's also the most fun to feed, I think,
Yes.
watching her come out of that trapdoor and take
So
prey.
fast.
Yeah. So I guess if I had to pick one, it would be her.
If I gave you two, I'll make it easier because this way you'll have less regrets or fewer regrets when we get off. What would the other one be?
Man. I guess my H. Chilense.
I, I somehow knew that's where it
Yeah.
was going.
Yeah. She is also um, just really cool, and I think they're good. Hopefully, they become more common. I think they're really good introductory
Yeah.
tarantulas because they're just so calm. They're not gigantic, and
And
they're
curious.
fun to watch. Yeah, she's always walking around and looking at things, and always comes out when I open the enclosure.
Yep.
So
I
yeah, they're
think that's what
kind of
impressed me about them is that again, we don't have all the information about, how smart they are, their intellect, how they reason, whatever. But it's one of the few tarantulas I've kept that I can't help but think is a little smarter than some of the other ones. Just the way they kind of go around and they're not freaked out by you. They're more like, hey, what are we doing here? What's going on?
Yeah. So she's pretty cool. So those are probably right now, as you're asking me, my two favorites.
So, just to mix things up a bit, do you have a favorite genus of tarantulas?
Oh gosh.
This is tough for people that don't end up grabbing like every species in the genus, but I'm always curious because there's sometimes the answers differ.
I I don't know. Um I've got so many different genuses. I guess I would have to say I guess Brachypelma.
I can't argue with that. They're gorgeous.
There's so many cool ones. I would like to have all of them someday. Um, I don't know that I will. I don't know if I'll be alive long enough
Yeah,
to get slings of all of them and watch them grow up. So
it's a
I've
commitment.
kind of I've slowed down on getting those. I have a few slings that are now, I don't know, like 7 years old, and I feel like they've not grown in size at all.
Yep,
So it kind of I
I
kind
know
of
that one.
hesitate to get more slings, but they are really cool. And it's doable that if somebody was interested, you totally could get all of them
Yeah,
and have them. So I guess that would be my favorite.
and then the last one. What's top of your wish list right now? If you could have one,
Oh man, that also changes all of the
I
time.
hear you.
I have a T apophysis, and I would
Mm,
really like a sturmy.
oof. Can't argue that at all.
So
I love
yeah,
Megatheriophosis species. Absolutely love them. And you
yeah.
started
So
with
someday,
Apophysis.
yeah,
Was that your first? Yep.
yeah, that was the first one I ever had. I got a sexed female, so I
Oh,
really
nice.
lucked out. Yeah,
Yeah.
so someday I'll have a sturmy.
I did the. I started with Sturmy, hopped over to Blondie, and then the Apophysis was on the top of my wish list for several years to the point where I thought I had one. Somebody sold it, and it was a Sturmy. It was under the wrong name. And when I
Oh
finally got
gosh.
it, definitely well worth it. A buddy of mine it worked out because I got it, and like a doofus, I put video of it up and wasn't thinking anything of it. And somebody's like, "I've raised all three. That's not what you have." I was like, "Oh," but I got it for a good price, so it really didn't bother me. And then a buddy of mine lost his adult female Sturmy he'd had for many, many years. And I'm like, you know what? Here you go. And then, of course, right after that, I lost my female and wanted it
Oh
back. But
man.
you can't know. It was one of those like, oh my gosh, it was just terrible. But it grew up great. He loved it, so that it worked out. But then when I got the Apophysis, they're just different than the other two. And I like all three of them. I will say that I will always probably have three of them in my collection at any given time. They're just massive. It drives me nuts when people are just like, they're just big brown spiders. They're not. They go through so many neat changes, and obviously Apophysis. If you've seen the males, they're purple. What's better than a 11-inch purple spider?
Yeah, they're really cool. And also another one that you could have you could have all of them in a collection, which
Yep.
as
Yep.
I definitely have collector gene, I
Yeah,
guess.
as do I.
So yeah, so having a complete set, I guess, is something that I think is cool.
And then once you get it, it's kind of like I don't know, you feel better about it. It's like I got all three of you guys. I've done it with several
Yeah,
species now, and it's like I just love having them all. And then every once in a while, like Harpactor is another one I tend to grab them all. I keep getting males of certain species because I want like all the females. So I'll keep buying there. Well, Andy, I can't thank you enough. Again, I've said it a couple times. This was absolutely fantastic, a blast for me, and I'm absolutely positive it's going to be incredible for folks that listen to this. Because again, I like to do more of the educational stuff, and this has been an education for me. I'm coming away from this with things that I'm going to be rethinking because of our discussion. So I'm so glad. What I can say is it may have taken us a while to pull this off, but it was 150% worth the wait.
Oh, good. I'm glad you feel that way. This was fun. I don't often get to talk about them, so it's nice to be able to do so.
That's one of the good things about having the videos and the podcast is a way for me to kind of geek out and know
Yeah,
somebody's listening that appreciates it. Because I'm very cognizant of the fact that most people are not into them. Even when people try to prod me, I'm usually a little reluctant to get into it. But yeah, this was great it was fun for me because it's like talking to somebody else that not only keeps them, but knows a lot more about their care and how to make sure that they stay healthy. So thank you again.
you're welcome. Thanks for having me.